Let's get started with the first topic of pharmacology first, which is included in the B Pharm syllabus. So we have pharmacology first, second, and third. So here we are starting from the first topic of the pharmacology first, that is introduction to the pharmacology. So here in this introduction to pharmacology, we will mainly study about the pharmacokinetics and the pharmacodynamics and different terms which are used in the pharmacology, and we will study the difference between the drug, the medicine, and the different branches of the pharmacology like pharmacotherapeutics, etc. So let's start with the basics of the pharmacology. So first, what pharmacology is. So pharmacology, if we will define the pharmacology, we can simply say that it is science of drugs. So pharmacology is the science of drugs. So later I will define what the drug is and what the medicine is. So right now, for time being, the pharmacology, if we will define it, it is the study of the science of drugs, or we can see that it is the study where there is interaction. Interaction will be between the exogenous substance, so there will be interaction. So there will be interaction between the exogenous substance which will be administered from the outside, and this exogenous substance will be a chemical molecule, and this will interact with living system. This will interact with the living system, and this will interact with the human body. So here the pharmacology, it is interaction between an exogenous substance. This exogenous substance will be a chemical molecule, and this chemical molecule will interact with the living system. So interaction between an exogenous molecule with the living system, that is called as pharmacology. That is the simple definition of the pharmacology. Okay, so interaction of the exogenous substance, which is a chemical molecule, it interacts with the living system, and this whole study is called as pharmacology. Now in pharmacology there will be two main things. First one, which is called as pharmacodynamics. And second one is called as pharmacokinetics. Dynamics and kinetics. So these are the two things here. So first one is pharmacodynamics. So you can remember from this D means drug. Okay. So what drug does to body? What drug does to body? So when we take the drug, what that drug does with the body, that is called as the pharmacodynamics. Okay. And second one is kinetics. Kinesis means movement, or kinetic, it means movement. So from this you can say that kinetic means what the body does to drug, just reverse of the above one. What body does to drug. So first one, dynamics, what drug does to body. Here the body is in a static position, and when the drug goes into the body, what that drug does to the body, that is called as the pharmacodynamics. Second one is kinetics, means what body does to drug, what our body does to the drug. When the drug goes inside our body, what our body does to that drug, that is called as pharmacokinetics. So the basis of pharmacology starts from here, that means dynamics and kinetics. So you have to understand both these terms, what dynamics and about the kinetics. Okay, so first one, dynamics means what drug does with the body. So we can study here the relationship of drug concentration and biological effect. The relationship between drug concentration and then the biological effect. So concentration of drug and the biological effect, that will be mainly studied in the dynamics. Okay, and then there is kinetics. So we will study these two things later in detail. So next you have to remember some important points which may be asked in the competitive examination sometimes. First is father of pharmacology, which is Oswald Schimmelberg. Is called as the father of pharmacology. And father of Indian pharmacology, Ramnath, father of Indian pharmacology, okay, Ramnath Chopra. So sometimes these questions are asked in the computer examination, so these points are important for you people. So now I will go to the next point, which is the difference between the drug and the medicine. Okay, what is the difference between the drug? What is the difference between the drug and the medicine? Okay, so mainly there are three major differences between the drug and the medicine. First is on the basis of the dosage form. So drug, it is having no fixed dosage form. No fixed dosage form. So there is no fixed dosage form for the drug, while as for the medicine there will be a fixed dosage form. Fixed dosage form. That is the first difference between the drug and the medicine. Second, drug, it's not having any fixed dose, so I can say no fixed dose. While in case of the medicine, it has a fixed dose. Fixed dose. Third important thing, all drugs, they can't be medicines. All drugs can't be medicines. And here, all medicines are drugs. And sometimes, so these are the three differences. In case of the drug, there is no fixed dosage form, while as in medicine there is a fixed dosage form. In case of drug, there is no fixed dose, while in case of medicine there is a fixed dose. In case of drug, all drugs, they can't be medicines, while as all medicines can be drugs. And it also depends upon the dose, it depends upon the concentration. For example, you are taking the paracetamol 500 mg, so it is used as a medicine. You will increase the dose to 100 to 1000 mg, to, for example, 2000 mg to 4000 mg. So this drug will become a poison for our body if you increase the concentration. So it depends upon concentration also, that we will be discussing. Okay, so now I will go with the first thing, that is pharmacodynamics, because we have to study the pharmacodynamics and kinetics in detail. So the first one, that is pharmacodynamics. Pharmacodynamics. So I will be making you understand with some examples. So first one, pharmacodynamics. Already I told you, dynamics means D, what the drug does to the body. Okay, so there are three things what drug does to body. So drug will go into the body, what this drug will do to the body, so that's we will study in the dynamics. So three things will be there. Okay, first thing, that is there will be a physiological effect. Second thing, there will be a biochemical effect. And third, then, mechanism of action. So these are the three important things here. Okay, so physiological action, it will change the physiology. Will it change physiology or will it not change the physiology? Second one is, it will interact with the chemicals inside the body, that is the biochemical effect. And third one is the mechanism of action. It will act on our body and it will produce an effect, desired effect, which we need. Okay, so these are three important things. Now I will give an example to make you understand the pharmacodynamics. I will take the example of adrenaline. So here I am taking the example of adrenaline, which is a hormone present in our body. Okay, so this adrenaline, it is where it's present, mainly it is present in the adrenal gland, adrenaline, which is located on the kidneys. Okay, superior part of the kidney, it's situated on the superior part of the kidney, adrenaline. Okay, so this adrenaline is important for our body because it helps mainly in flight or fight response. So fight or flight response. So these are two important things which are related to the adrenaline. Second thing, it acts on receptors which are called as adrenoreceptors. Okay, it acts on the receptors which are adrenoreceptors. Okay, so these receptors are mainly of three types, either alpha, 1, alpha 2, beta. And in alpha 1 it can be, these are three main types. Okay, in alpha 1 it can be alpha 1a, alpha 1b, alpha 1c. This is the classification of those receptors. In alpha 2 it can be alpha 2a, alpha 2b, and alpha 2c, while is in beta it can be beta 1, beta 2, and beta 3. So these are the receptors. So these all are the receptors on which adrenaline will act. So these all receptors are called as adrenoceptors. Okay, so we have to study three things: physiological, biochemical, and mechanism of action. So these adrenoreceptors, one more thing which you can add here, these adrenoreceptors are G protein coupled receptors. That is an important thing, can be asked in examination, can be asked in GPAT or any computer examination or NIPER examinations. So this adrenoreceptor, these are G protein coupled receptors. So that is one more topic which we have to study. Okay, it is a G protein coupled receptors. Okay, so G proteins, these can be GI or GS. GI means G, it is inhibitory in nature, and GS means it will be stimulatory in nature. Inhibitory means it will inhibit some function. Stimulatory means it will increase some function. For example, increase in the heart rate, that means stimulatory function. Decrease in the heart rate, that means S function. Inhibitory function. I means inhibitory, it will inhibit some function. For example, decrease in the heart rate. Stimulate means it will increase some function. For example, increase in the heart rate. Okay, so that is about the receptors. Now I have taken the example of the adrenaline. Now I will make you understand how this adrenaline acts on the body, because we are studying here pharmacodynamics, what the drug does to the body. Okay, for example, you are taking adrenaline from the outside, or adrenaline is already present in the body. So when this adrenaline comes, so this adrenaline will act on the receptors which are called as adrenoreceptors. Okay, so here I am making the I will draw the structure of the membrane because it will act on the cell. So I am here, will draw the structure of the membrane. For example, so this is the membrane which is made up of phospholipid bilayer. Which you have already studied in the anatomy and physiology portion. Lipophilic and lipophobic ends will be there. So this is the membrane. Okay, so now adrenaline, it will act on adrenoceptors. These adrenoceptors are present in this membrane. Okay, so here it will be acting on the alpha 1 receptor, for example. So for example, this receptor here is alpha 1 receptor. Okay, so this receptor here is alpha 1 receptor, and this alpha receptor is a G protein coupled receptor. I already told you that. So here, for example, it is GQ. It's also a stimulatory type of receptor. Okay, so when the adrenaline will act, either there can be stimulation or there can be inhibition. For example, here it acts on the alpha 1 receptor and it causes the stimulation. So there will be, I will write the positive sign. Positive sign is for stimulation. So it will stimulate something. What it is stimulating here? It's stimulating adenyl cyclase, which is present inside the cell. And this adenyl cyclase, in turn, it activates 3-5-adenosine monophosphate, AMP. Okay. So what happens that in case of the pharmacodynamics, adrenaline, it enters the body, it acts on the cell. This is the cell, this is cell membrane. So it acts on the cell membrane, then it stimulates, it activates. For example, it can act on any one of the receptors I mentioned above. Here I am giving the example of the alpha 1 receptor. It acts on the alpha 1 receptor, which in turn, because it is a G protein coupled receptor, means this receptor is coupled with the G protein. Okay, this receptor is coupled with the G protein, so it can't act on its own. It has to stimulate either GI, GO, or GQ. Okay, so it is activating the GQ receptor. Okay, then it stimulates adenyl cyclase. Adenyl cyclase will stimulate, it will activate 3-5-AMP. When this 3-5-AMP comes inside the cell, what it does, it releases calcium from sarcoplasmic reticulum. release of Ca2 from sarcoplasmic reticulum, which is present in the muscles. Okay, so this 3-5 AMP, it causes the release of calcium from the sarcoplasmic reticulum, which is present in the muscles, and we know that calcium has a function, is it causes contraction. And here I was giving the example of the heart, so it causes the contraction of heart, or I can say stimulation. So I already told you, either it can cause the stimulation, either it can cause the inhibition. So in short, I can say that adrenaline, it interacted with the adrenoreceptors, which is a G protein, okay, which in turn causes stimulation of the cell membrane bound adenyl cyclase, which causes increased intracellular cyclic 3-5 adenosine monophosphate, and that causes cardiac stimulation, or it can also cause hepatic glyconeolysis. Okay, hepatic glyconeolysis. It has much more functions, so I will just give a simple examples here. It can also cause hyperglycemia. So it can also cause hyperglycemia, increase in the blood sugar level. Okay, so that is how the adrenaline acts on our body. So this is one of the example of the pharmacodynamics. So physiological, biochemical, so you can see it will change the physiology. Second, it will interact with the biochemicals. So that is the mechanism of action of adrenaline. Okay, you can say that in dynamics we mainly study the mechanism of action. So this was the mechanism of action of the adrenaline. Okay, now we will go to the second part. For example, the second example, that was the first example. Second example, for example, non-steroidal anti-inflammatory drugs. Examples, for example, aspirin, paracetamol, aceclofenac, diclofenac. These are all the examples of the non-steroidal anti-inflammatory drugs. So I am taking the example, for example, I will take the example of the aspirin. Okay, so we will have to study here the dynamics of the aspirin. So here, in case of this, when there is any case of any type of injury, so I will change this color here. For example, our membrane, it's made up of membrane phospholipids. So this membrane phospholipid, it is present in the cell membrane when there is any physical or chemical injury. So what it does, this physical or chemical injury, it activates phospholipase C. It is a phospholipase C. Okay, so it will activate the phospholipase C, which in turn converts the membrane phospholipids into arachidonic acid. So membrane phospholipids, these are present in the membrane. Already I told you, because the membrane, this membrane, it's made up of the phospholipids. So I have written here the membrane phospholipids. So these membrane phospholipids, whenever there will be a physical or chemical injury, so these membrane phospholipids will activate the phospholipase C, which in turn will activate arachidonic acid. Okay, this arachidonic acid acts on two things. One, cyclooxygenase, and second one, lipooxygenase, which we call as COX and LOX. Okay, so these are two types, cyclooxygenase and lipooxygenase. Then this cyclooxygenase is further of two types. It's COX first and second is COX second. So these are the two, COX first and COX second. Then there is lipooxygenase, which in turn means activates leukotrienes. I will write here LTs. LTs are the leukotrienes. Okay, these leukotrienes can cause bronchoconstriction, asthma attacks, smooth muscle contraction. Okay, so I will give one example. These leukotrienes, for example, it causes bronchoconstriction. So that is one example. Okay, so these are the leukotrienes. Then there is COX first and COX second. This COX second, it helps in the secretion of mucosa, which is important for our stomach because it protects our stomach from the acid. So it will help in the secretion of the mucosa. I will add one term here. So it is, for us it is beneficial. So COX first, it's very important because it has a protective action. It helps in the secretion of the mucosa. It prevents the stomach from the ulcer. So it protects our stomach from the ulceration. Okay. Now second one is COX second. It gives further rise to leukotrienes, LTs, thromboxanes, T-axis, and PGs, prostaglandins. Okay, and then these prostaglandins will cause pain, fever, inflammation. So I have also defined here the mechanism of pain, fever, and inflammation. How the pain, fever, and inflammation occur in our body. So this is the mechanism for that. Now, here I have to explain you the action of, for example, I have given the action of aspirin. Okay, how the aspirin acts on our body. So aspirin, what it does, it inhibits both COX first and COX second. Aspirin, it will inhibit, minus means it will inhibit COX first, it will inhibit COX second. So that's why aspirin has one side effect. It causes gastrointestinal or you can say gastric ulcers. Why it causes gastric ulcer? Because it blocks COX first also, which helps in the secretion of the mucosa. So if the mucosa is not secreted, so the acid will directly affect the stomach, which causes the gastric ulceration. So we can't take aspirin for a long period of time. Generally, when we take aspirin for a long period of time, we give proton pump inhibitors with it too. So that's another concept. Okay. So aspirin, what it inhibits? COX first, COX second. Okay. So side effects, I already told you: acidity, internal stomach bleeding, there will be ulceration, there will be blood thinning also. This blood thinning is the side effect of the aspirin. Blood thinning. But this blood thinning as the side effect of the aspirin is used as a therapeutic effect nowadays in heart attack patients which have suffered from the heart attack or which have clots in their body. To thin the blood, to dissolve that clots, to break down those clots, we can use the aspirin. Okay. So if aspirin acts on both COX first, COX second, it will cause inhibition of mucosa, and that leads to direct contact of acid in the stomach, and it will cause the ulcers. So that is the adverse drug reaction which I already told you. Okay. There is also saricosib, or these are also the drugs which inhibit COX2. So for example, saricosib, it inhibits only the COX2. Okay. So that is the drug we can take. So this was about the pharmacodynamics. Now I will take the second example. I will take the second thing which we have to study, that is pharmacokinetics. Pharmacokinetics. What the body does to the drug. This is the body. What this body will do to the drug which we have taken. So what our body, here the main focus is on the body. So what the body does to the drug, that is called as the pharmacokinetics. Okay. So here what will be the first thing? You have taken some drug. This drug, movement of drug inside the body. So this drug will go inside the body. So there will be a movement. Then there will be alteration of drug by body. Alteration of drug by body means change. There will be some change in the drug by the body. Okay. So here mainly what happens to the drug, what the body does to the drug, is there are two main things: absorption, distribution, metabolism, and excretion, which is called as ADME. So absorption, distribution, metabolism, and excretion, these four things will happen to the drug. So that is what the body does to the drug. Body will do the absorption, it will do the distribution of the drug, then it will do the metabolism of the drug, then the drug will be excreted by any of the routes. Okay. For example, for this I will give you a simple example of paracetamol. Okay. I am taking the example of the paracetamol. Paracetamol is a hydrophobic. Hydrophobic means water hating. Okay. And it is analgesic, antipyretic, and it has a poor anti-inflammatory action also. Okay. So this paracetamol, this is completely absorbed orally. absorbed orally. So first thing, absorption, it is in the oral. So absorption, it will be completely absorbed orally. Then after that, peak levels of this paracetamol. So peak levels, these peak levels are obtained after 30 to 60 minutes. Okay, after 30 to 60 minutes, there will be peak levels of paracetamol present in the blood. Okay, and this paracetamol, PCM, it's almost 25% will be bound to plasma proteins. Plasma proteins, for example, albumin, etc. Okay, and generally to the serum albumin. Serum albumin. Okay, then there will be distribution, because this is absorption, then it will be distributed throughout the body to site of action, to other tissues. Okay, then there will be metabolism. Metabolism will occur in the liver. You might have heard, we must not take too much paracetamol because it affects the liver, because metabolism occurs in the liver. Okay, and metabolism will occur by various reactions. There are first phase, second reactions. Okay, and generally the metabolism occurs by sulfate conjugation. It conjugates with the sulfate, or glucouronide conjugation. Conjugation means the paracetamol, it will react with sulfate or it will react with glucouronide and it will be metabolized. Okay, so sulfate plus drug, then it will be excreted in the urine. Metabolism, after metabolism there will be excretion, and the excretion will be through urine. Okay, so this was, so generally biotransformation will occur. Okay, so this was about the pharmacokinetics. Kinetics means what the body does to the drug. So here the important focus or main focus will be on the body, what the body does to the drug. So what body did to the paracetamol? It did absorption, it did distribution, then it metabolized the drug, then it excreted the same drug. So absorption was done, it was completely absorbed orally, then it was distributed throughout the body by the use of the plasma proteins. Okay, then it was metabolized, and metabolism occurred by use of sulfate conjugation and glucouronide conjugation. Then it was excreted through the urine. Okay, excretion occurred in the urine. So now this was about the pharmacokinetics and pharmacodynamics. If you have understood this, then you can go ahead with further some terms and all. For example, I am taking some important terms which are important in pharmacology. Okay, so first term, that is pharmacotherapeutics. Pharmacotherapeutics. Pharmacotherapeutics means in this there is application of pharmacological information. Okay, so we will use the knowledge of disease, okay, and then cure. So this is called as the pharmacotherapeutics, where we are using the pharmacology to treat the disease. So pharmacology is used here to treat the disease, that is called as pharmacotherapeutics. Okay, so we will apply the pharmacological information, whatever information we got from the pharmacology of a drug, we will use that information to treat the disease or to prevent the disease or to cure the disease, that is called as pharmacotherapeutics. So next one is clinical pharmacology. Clinical pharmacology. So clinical pharmacology means where we study the drugs, both the old drugs as well as the new drugs in the humans. Study of drugs in humans. That is called as the clinical pharmacology. Okay. So clinical pharmacology, we study this because we have to go through a concept that is called as the evidence-based medicine. Okay. So next is, which is important here, is chemotherapy. These will be some of the terms which you will be using. Chemotherapy. So chemotherapy means systematic infections or malignancy or cancer. These are treated with specific drugs. Okay, and this is called as the chemotherapy. And chemotherapeutic agents, they can be dynamic agents, they can be kinetic agents. Okay. Then there is one more thing, which is toxicology. Study of toxic effects of the drugs or poisonous effects of the drugs Okay, that is called as the toxicology. So that is also important term which is used. Okay, toxicology. Now one more thing which is there, which we have to study, is orphan drugs. Orphan drugs. Okay, so orphan generally means, which is generally we use this term anyone who is not having a father or a mother is called as orphan. But here these are the drugs, or we can say these are the biological products which are used either for the diagnosis, either for the treatment or prevention. So diagnosis, either treatment, or either prevention. So these are the drugs which can be used for the diagnosis, treatment or prevention of a rare disease. So those drugs which are used for diagnosis, treatment or prevention of a rare disease, those drugs are called as orphan drugs. For example, the rarest disease which is present these days is a deficiency of ribose 6-phosphate isomerase. Ribose 6-phosphate isomerase. So if there is a deficiency of this, so it is the rarest disease. So the rarest disease in the world is this one, where there is deficiency of ribose 6-phosphate isomerase. So if anyone is having the deficiency of this, it will cause loss of eyesight. That is the first thing, loss of eyesight, and then there will be no movement of the body. Okay, so for these rarest diseases we are using some drugs. Those drugs are called as orphan drugs. So the drugs which are used to treat the rare disease, orphan drugs, for example sumatriptan, which is used for treatment of migraine generally. Rifabutin, used for treatment of tuberculosis. Liothyronine or leothreonine, which is used for treatment of liothyronine, where there will be deficiency of T3, it will be used here. Digoxin, cardiovascular system. Amphotericin B, nitrates. Okay, so nitrates, this can be antifungal, etc. So you can remember this by mnemonics. For example, SRK, everyone remembers SRK. SRK, you can say that SRKS, it is a sumatriptan. DDLG का fan, FAN, fan है. So S means sumatriptan, then D means digoxin, then another D means sumatriptan, then this D is digoxin. Okay, then F means fomepizole, A means amphotericin B, and N means nitrates. So these are the drugs which are called as these are the drugs which are used for treatment of rare disease, and these drugs are called as orphan drugs. Okay, so one more thing which we can add here apart from the orphan drugs is essential drugs. Essential drugs, there are almost 384 essential drugs to be precise. Okay, and these are those drugs which are mostly used by the population. They are safe for the population, they have maximum therapeutic effect, and these are the most commonly used drugs. And currently these are almost, this list changes. So right now there are 384 essential drugs. Okay, then there is one more term, prescription drugs. Prescription drugs are those drugs which are given only under the medical prescription. For example, I can say the example of antidepressants. So antidepressants will be only given by the use of the prescription. Okay, so if you have a prescription, you have prescribed that drug by any doctor, then only you can take that drug. So that is one more example of the prescription drugs. Okay, so that was all for the basics of the pharmacology or introduction to pharmacology. So we will get connected in the next lectures. Till then, thank you.